Good morning and welcome to Inside South Florida. I'm Dave Azer. On today's show, all you weekend warriors and exercise buffs who want to stay fit without getting hurt, well, we've got the Chief of Medical Affairs for the NBA to drop by with some tips. Plus, a local jewelry designer will show you how to bling in the new year and how you can help fight Crohn's and colitis by playing football at Sun Life Stadium. That, your social calendar, and more as Inside South Florida starts now. If you're hitting up CrossFit 3 times a week or just want to shed a few pounds, you need to know how to exercise without getting hurt. Well, here with the answers is Dr. Jace Provo, a sports medicine physician with Sports and Orthopedic Center in Boca Raton and the Chief of Medical Affairs for the NBA with the answers. Dr. Provo, good to have you here.
Thanks for having me.
This is a good time of year for all those weekend warriors, right? Between your holiday football games and your New Year's resolutions to get in better shape. So there's going to be a lot of South Floridians out in the community playing sports. So let's start with this. Give me some measures that we can all take to avoid some injuries.
Well, first of all, we're really lucky to be living in South Florida where we can actually work out year-round and we can enjoy our activities and our sports year-round. That's a real privilege, because if you live up north and you get good at something, you have to stop for several months. But because we live year-round, we have a larger opportunity to get injured. So especially if you're a weekend warrior, which I am, I'm a cyclist, it's really important that you maintain good physical health, that you get your annual physicals so you know that you're in proper shape to exercise, and then you train properly so that you minimize the risk of injury. I make my whole living off of taking care of injured people, but I'd much rather that you don't get injured and you can enjoy your sport. And our objective is to return you back to your activities safely. All
right, a couple of questions that people have asked me to ask you. Stretching. The importance of stretching before, during, and even after you've exercised.
It's a very interesting question. Traditionally, people are taught to stretch before they exercise. The American College of Sports Medicine has spent a lot of time looking at this. We break stretching down into 3 primary categories: static stretching, ballistic stretching, and neuromuscular proprioceptive stretching, which is a lot of words for doing it when you're sitting still before you do anything, bouncing while you do it, and then stretching as you exercise. The one that appears to be the most effective is actually stretching while you exercise without the bounce. There's actually no study that conclusively shows that stretching before exercising decreases the risk of injury.
Interesting. So how do you practically do that, stretch while exercising? So let's just say you're playing basketball, for example. Is it, what, during you take 5 minutes to stop playing and stretch, or how do you do it?
Well, you start off by beginning slowly, and you get your muscles warmed up, and then, once again, it's sport specific, so it depends on which activity you're involved in. But what you do is, after you've gotten your muscles warmed, then you begin stretching exercises where you stretch the gastrocnemius muscles, the calf muscles, the hamstring muscles, the lower back. There's really no evidence that doing it before you start actually decreases the risk of injury.
Wow.
So after you start really makes a big difference.
Okay, good to know. Another one that I get is heat versus ice. If you twist an ankle or pull something in your back or whatever, is heat better than ice better than heat? Does it matter?
Great question. It depends on the injury. The purpose of ice is to decrease swelling into the area of the acute injury. So if you're going to hurt yourself and you need to do something right away, do ice. By decreasing the swelling, you decrease the amount of swelling you get, and it gives you a chance to sort of cut that down and let yourself heal a little bit. A lot of the pain associated with joint swelling has to do with how swollen up the joint gets. So if you can decrease that initially, you're going to feel better. That's probably only of value for the first 24 to 48 hours. After 24 to 48 hours, you've gotten to the maximal point of swelling, and heat increases the blood flow into the area, which brings all the healing cells into the area that are going to make you heal faster. So for the first 24 to 48 hours, ice. After that, heat. Balanced diet, eat less, exercise more. And if you do that, you're going to get weight reductions and you're going to be in better shape. Your heart's going to be healthy, you're going to feel better, you're going to get rid of your back pain, and you're going to live a longer, healthier life.
And then one day you can dunk like LeBron James. which brings us to this. You are the Chief of Medical Affairs for the NBA.
Yes.
That's a cool sounding title, if nothing else. What does that mean exactly?
I'm a very average guy who's been very fortunate to be affiliated with the National Basketball Association for 20 years. This is my 20th anniversary. I'm Chief of Medical Affairs. I oversee all the healthcare-related activities for the NBA, the WNBA, and the NBA Development League, our minor league.
Do you travel around the country, or what?
I travel around the country and around the world. In the last, since August 1st, I was in London for the Olympics. I was in South Africa. I was in Russia, both for basketball camps. And then I was in China for the NBA preseason China games with the Miami Heat and the LA Clippers.
Fun.
Fun.
So without talking about specific players and specific injuries, I know we can't do that. What are some of the more common things that you watch for when you're watching these guys play?
These guys are amazing athletes. They're 2 standard deviations plus from norm. You know, they can jump really high, they are amazingly large, they have incredible burst energy. They're really some of the finest athletes on the planet. That being said, they can get injured. One thing that I think is really important for any athlete, we were talking about starting an exercise program. Even at the pro level, if you have all the genetic blessings that make you 6'11" and muscular and strong and able to dunk, you really have to focus on your basics and your core. And whether that's an elite all-star level NBA player or whether it's a weekend warrior that wants to do CrossFit, it's really all the same. So for these guys, it's core balance, strengthening the basics, fundamentals of their game, and keeping them from getting injured.
Dr. Provo and I have been doing crunches the entire interview, right? That's what you have to do. But seriously, you know, because I hear that, like people say that while they're driving a car, they work on their core. I mean, I know that might sound silly, but I guess there's ways during the day where you can be working out even if you're not at the gym, right?
Yeah, there's several different factors to being in shape, and there's lots of different measures. Once again, a lot of it is sport specific. I'd say the take-home message for the general audience is pick a sport that you like. Make sure that your core is appropriately trained, which means the muscles that support your pelvis and your back and your upper body, not the glory muscles, not the ones that we lift in a gym, but the ones that stabilize you, and then go out and get your heart rate up and burn some calories and have fun doing it.
Well, it was great to have you here. Off camera, I'm going to get some fantasy basketball advice from you. You're going to tell me who's injured. I'm just kidding. We're not going to do any of that. But seriously, thanks for coming by, and it was a pleasure to talk to you.
Thank you. I appreciate it.
For more information about Dr. Provo, just go to sportsorthocenter.com. When we come back, whether you're a lady looking to buy some nice jewelry or a guy who needs to get his girl some bling, we've got you covered.